Hello, my name is Amber LaRock and I am a staff writer with Emergency Vets USA as well as a licensed veterinary technician. Our goal at Emergency Vets USA is to educate pet owners on topics regarding their pet's health. So today we'll be discussing hemangiosarcoma in dogs and when to know when it's time to say goodbye to your dog with hemangiosarcoma. Hemangiosarcoma in dogs is a cancer that is derived from the lining of the blood vessels. The tricky part about this is that there are blood vessels in every inch of our dog's body, meaning it can occur virtually anywhere. Many hemangiosarcoma tumors in dogs are also filled with blood, meaning they can lead to life-threatening bleeding if tumors rupture. Hemangiosarcomas are also known to spread to other parts of your dog's body, so this means it can lead to systemic complications. Hemangiosarcoma tumors are also typically pretty aggressive, so early detection is essential in offering your dog a chance at recovery or prolonging their time. Diagnosing hemangiosarcoma in your dog will vary based on the type of hemangiosarcoma that they have. Hemangiosarcoma is also really difficult to examine via fine needle aspirate, so usually the only way to properly diagnose it is through examination of tissue, which has to be performed by a pathologist. If your dog has hemangiosarcoma of the skin, meaning that you or your vet may have stumbled across any new lumps and bumps on their skin, if this is the case, your vet will examine the new lump or bump and have it sent off to a pathologist for review if they think it's concerning. Hemangiosarcoma in dogs of the skin is usually much easier to diagnose, whereas hemangiosarcoma in other areas can be a bit more challenging to diagnose due to the fact that owners usually don't know their dog has any complications until it is too late or until they have life-altering symptoms. Many cases of hemangiosarcoma will occur on the spleen, the liver, or the heart, making this extremely challenging to know that your dog has it unless your vet stumbles across it accidentally on x-ray or until the mass starts bleeding and owners notice significant lethargy, weakness, collapse, pale gums, and other signs of bleeding. If your vet does happen to come across a questionable mass performing routine x-rays, they can offer exploratory surgery where they remove the mass in question and send off the tissue to be biopsied. If it does come back as hemangiosarcoma, they can offer you chemotherapy and radiation therapy. The only issue is, as we mentioned before, hemangiosarcoma has a high likelihood of spreading to other parts of the body. So this means that chemotherapy and radiation and surgical removal may be preventing a massive bleeding that could have occurred soon, but it's usually just giving your dog a little bit more time, but your dog will likely succumb to the hemangiosarcoma eventually. If your veterinarian is concerned with visceral hemangiosarcoma due to active bleeding, this will require an aggressive and immediate response. This often involves your veterinarian taking your dog to emergency surgery, removing the bleeding mass, and this may also involve offering them blood products to restore their blood loss. Your dog will likely have to stay in hospital for a few days after this because it is a major surgery, especially if they have lost a large volume of blood. And at that point, if they have removed the mass successfully and your dog makes it through surgery, then they can send off the tissue for biopsy. Based on the biopsy results, you and your vet can discuss whether you would like to pursue radiation or chemotherapy options to help extend your dog's life, but sometimes owners opt to not go forward because this can be challenging for a dog to go through, and again, hemangiosarcoma has a high likelihood of spreading, meaning that your dog will likely succumb to the condition at some point. But radiation and chemotherapy is an option if you would like to extend your dog's life and they are in decent health. The average life expectancy of dogs with hemangiosarcoma is generally up to 6 months. However, this can be extended up to a year if a dog receives corrective surgery to remove the hemangiosarcoma mass and if they receive chemotherapy and radiation. But typically we don't see any more than a year with these dogs. If you're struggling with when to say goodbye to your dog with hemangiosarcoma, there are always a few factors to consider. The first one involves the fact that if your dog is actively bleeding and you are unable to pursue corrective surgery, your veterinarian at that point will likely discuss quality of life with you. If your dog is actively bleeding, they do have a slim chance of survival without medical intervention, so your veterinarian will likely discuss the possibility of euthanasia with you. Not all dogs will actively bleed due to their hemangiosarcoma mass, but they may begin to decline in other ways. You may see a dog begin to lose weight, they may become anorexic, refuse to eat their food, They may experience weakness, and you may just see a drastic decline in their health and their energy. A lot of times, owners take this as a sign that their dog is tired, and they decide to make the decision to say goodbye at that point. Hemangiosarcoma is a really tricky and dangerous condition in our furry friends, so if you would like a more in-depth review of the condition, check out the article that is linked to this video, but if not, stay tuned for more information from Emergency Vets USA.